When is the Susan Shore tinnitus device coming out? If I had $1 for every time somebody asked me that question, I could probably fund the FDA approval process myself. Look, I do get it. We've all been hearing about this miracle tinnitus device for years. We've seen the headlines and we've read the studies. And you're sitting there and ringing is in your ears and you're wondering, can I get this thing or not? I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus in Utah. And today, I'm going to give you the straight answer on where the Susan Shore device, also known as the Auricle device, actually stands right now, what the research really shows, who it's designed to help, and most importantly, what you can do today instead of waiting around for something that may or may not be available anytime soon. Let's cut through the hype and get to the facts. First, let's talk about what Dr. Susan Shore and her team at the University of Michigan have actually found, because the results are genuinely promising. They published their main study in the Journal of American Medical Association Network Open back in June 2023. This was a really rigorous, double-blind, randomized study with 99 participants. And that matters because you can't just wave your hands and say something works. You need real scientific data. And here's what they found. Over 60% of participants reported significantly reduced tinnitus symptoms after just 6 weeks of active treatment. We're talking real improvements. People reported better quality of life, lower handicap scores, and measurable reductions in tinnitus loudness. Now, I understand 60% is not 100%, right? But in the tinnitus world, when you're dealing with a condition that's notoriously difficult to treat, 60% of patients reporting significant changes to tinnitus is actually really encouraging. What's interesting is that these benefits didn't show up when people just used sound therapy alone. The magic seemed to be in the combination, the bimodal stimulation, and participants who stuck with the treatment longer generally saw better results. Quick request, before we go further, if you're finding this information helpful, please go ahead and hit that like button and subscribe to the channel. We put out evidence-based tinnitus information every week, and your engagement helps us reach more people who are struggling with tinnitus and looking for real answers. All right, so what is this thing and how does it work? The Auricle device uses what's called bimodal or bisensory stimulation. That's a fancy way of saying it stimulates 2 different sensory systems at the same time. Your auditory system through headphones and your somatosensory system through mild electrical stimulation on your neck or jaw. Here's the theory behind it. The auditory system is connected with the somatosensory system in an area called the dorsal cochlear nucleus, deep inside your brain. This is where touch and sound signals meet. Dr. Shore's research suggests that in people with tinnitus, the neurons in this area of the brain are firing too much and in sync with each other, creating that phantom sound that you hear. The device delivers precisely timed stimulation that's customized to your specific tinnitus. The sound part matches your tinnitus frequency, and the electrical part is adjusted to just above your threshold of sensation. The goal is essentially to retrain those overactive neurons back to normal levels. It's not magic. It's called neuroplasticity. You're literally rewiring how your brain processes these signals. Now here's the really important part. This device is not designed for everyone with tinnitus. The study that they did recruited 99 individuals with something called somatic tinnitus, a form of tinnitus where movements like clenching your jaw or applying pressure to your forehead results in noticeable changes in pitch or loudness of your tinnitus. So if you can change your tinnitus by moving your jaw around or turning your head back and forth or pressing on your face or neck, that's somatic tinnitus. That's the type of tinnitus that this device is designed to help. If you can't change your tinnitus at all with body movements, we honestly don't know yet if this treatment will work for you. The research just hasn't been done on non-somatic tinnitus. Also, participants in the study had normal to moderate hearing loss. So if you have severe or profound hearing loss, again, we don't have data on how well this will work for you. By the way, drop a comment below and let me know, can you change your tinnitus with jaw movements or head position? I'm curious how many of you watching this actually have the somatic form of tinnitus. And if you've got questions about your specific situation, leave those in the comments too. I read through them and try to answer as many as I can. Okay, the million-dollar question. When can you actually get this device? Here's the truth. We don't know. And I know that's frustrating. It currently does not have FDA approval. Dr. Shore and her team have formed a company called Auricle to commercialize their device, and they've stated that they're engaging with the FDA concerning regulatory clearance, but they're not making public comments about where they are in that process right now. Based on what we know about the FDA approval process for medical devices, even under the best circumstances, it can be expected to take between 12 and 18 months for approval from the time of submission. And we don't even know for certain if they've submitted yet. I've seen speculation online about 2026 maybe. Honestly, nobody outside of Auricle and the FDA really knows. There was a Q&A session in October 2025 that got people really excited, but they specifically declined to answer questions about a release date. So at this moment, there's no guarantee or clue about when the device will actually become available to the public. What I can tell you is that getting a medical device through the FDA approval process takes time for good reason. They need time to verify safety, manufacturing quality, that the device performs as claimed. It's not a fast process, but it is thorough. So what can you do right now if you have tinnitus? Here's the thing, you don't have to wait. There is an FDA-approved bimodal stimulation device available right now, and we offer it in our practice right now. It's called Lenire. This is important. Lenire has FDA approval for treating tinnitus. It's been through that regulatory process. It's on the market now, and it's helping people today. Now, Lenire works a little differently than the Susan Shore device. It uses tongue stimulation with the sound therapy instead of neck or jaw stimulation. And here's a key advantage. Unlike Susan Shore's device, which is specifically designed for somatic tinnitus, Lenire can be used for various types of tinnitus. You don't have to be able to change your tinnitus with jaw movements to be a candidate for Lenire. Look, I get it. Everyone's excited about the Susan Shore device because the research is so solid. But while we're waiting for that, why not try something that's available now? So if you're living with tinnitus and wondering, what's the best treatment right now? Here's my honest answer based on guidelines that are published by the medical associations and everything that we see in the clinic and research. Number one is Lenire. This is the most advanced FDA-approved bimodal stimulation device currently on the market. It's non-invasive, home-based, and doesn't require you to have somatic tinnitus. For many patients, it's a game changer, especially those who don't want to wait years for Susan Shore's device. Number two, hearing aids. If you have measurable hearing loss, modern hearing aids are very effective because they reduce the contrast between the tinnitus and the world around you. Many now include tinnitus-specific sound masking features. Then there's cognitive behavioral therapy, which is the gold standard for tinnitus-related anxiety or depression. It doesn't remove the sound, but it changes your brain's reaction to it, often reducing distress and improving sleep. And finally, tinnitus retraining therapy. This combines education, sound therapy, and counseling. It's one of the longest standing research-backed approaches, especially effective if your tinnitus is stress-driven or tied to hearing loss. Each of these approaches is best for different types of patients. What's best is not a one-size-fits-all solution when it comes to tinnitus. We need to find what works best for your brain, your ears, and your life. That's why in our practice, we use a comprehensive approach. We'll figure out what's driving your tinnitus, what type you have, and create a personalized treatment plan. That might include Lenire. It might include other therapies. Most often, it's a combination of multiple therapies. That's how we achieve a 90% success rate with our tinnitus patients. I know some of you are scared that the ringing might never stop, that this is your new normal, and that thought alone can feel unbearable. You're not just tired, you're drained, mentally, emotionally, physically. And I need to say this clearly. Hope is not a strategy. If you're sitting around waiting for the Susan Shore device to get approved, I get it. The research is great and it is exciting. But you're gambling with the quality of life by doing nothing now. You don't have to wait. There are effective, science-backed treatments available right now. If you want to learn more about your options, check out our online learning center. Links are in the description below. And if you're in Utah and ready to stop waiting and start healing, schedule your appointment today. Let's figure out what's going on and build a plan that actually works. Not just someday, but today.